What's up? I'm Jordan. I'm from Northern Virginia and I'm a VCU class of 2022 graduate. Now I know what you're thinking. Not another assigned reading. I get it. I was in your shoes 4 years ago. But your book, The Organ Thieves, is different because you go to VCU. The conversations that you will have, I urge you to listen but also amplify the voices of others. The conversations that I had, I quickly found my passions. And one of them was volunteering for food insecurity within the Richmond community. Now, VCU has a lot of history, and the people following me know all about it. I urge you to make a difference in whatever way that might look for you.
In 1968, there were over 100 heart transplants that took place across the world, but they all had rather dismal results. MCV continued to transplant in 1968 after their first failed attempt, and in August, they transplanted a heart into Lewis Russell. This was a successful transplant that added 6 years of life to Mr. Russell and continue to inspire the program to continue their research. In the 20 years from the first human heart transplant, there were a number of developments that moved the procedure from experimental to an accepted treatment modality. And those changes were a legal definition of brain death, development of new anti-rejection drugs that will allow patients to live for a while with their new organ, and easier ways to procure organs, both through legislation and development of preservation strategies to keep organs viable for longer periods of time.
I have read the book, and I thought it was really an amazing work, truly revelations about the past and how things were done. For me as a transplant professional, the book was very enlightening. The key element of these events was the lack of informed consent and lack of consent by family members. That particular piece today would not happen. There's simply no scenario in which a family member wouldn't be contacted and give permission for organ donation. There are some very specific sequences and very specific checks and balances as to how it happens that organs are available to transplant centers, to patients for donation and for transplantation. The development of anti-rejection medicines has been an absolute pivotal moment, a true watershed, frankly, in the narrative of the success of organ transplantation in this country and really worldwide. The patients that we serve now are much more diverse. The staff is diverse and quite different than the staff in the 60s. We specifically recruit for diversity. We aren't frozen in time, and we learn the lessons of the past and we try to improve on them. And it's a ongoing, never-ending process.
The structure we practice in is much different than it was at the time of the book. There are many more expectations now than what you read about in the book, where there were very few standard expectations at all at the time. When you think about consent, this is a process by where that provider and that patient or their representative are really thinking through, what are we talking about? What are the benefits to me? And what are the risks to me? It is critically important to know who that human is when you're going to be making decisions that might be for some sort of life-threatening problem. The more complex something is, the more we have to spend the time, the energy, and that piece of humanity to make sure that we understand who we're taking care of, what's really important to them, and that they really understand what we're talking about.
It really brings up issues around whose voice matters, particularly when we're talking about communities that have been historically disenfranchised or oppressed. So a lot of times the issues that ethicists are negotiating or helping clinicians process through are around a lot of hot button issues, end-of-life care, abortion, reproductive rights, all of those kinds of things. We can always teach a standard. And whether that is the legal notion of a standard of care, or this is the standard our profession has agreed upon decades ago, 100 years ago, to say this is what we're about, this is our creed, if you will. These are guidelines that we follow in terms of our decision making, how we come about interacting with patients. And it's actually called professional identity formation is the term that's utilized. You are now involved in care. And as an ethicist, it's really about honing and shaping that decision-making process and allowing students to develop the cognitive skills and the critical reasoning, critical thinking skills, because it is attached to a human being that comes with a whole host of perspectives, thoughts, history, feelings. And so it is very important to consider holistically that individual.
There's been a long line of mistrusts at this particular medical institution and others across the country dating back to the 19th century. People are aware of Nazi medical atrocities, radiation experiments conducted at medical centers and by the federal government, and probably most nefarious, the Tuskegee syphilis study that ran from 1942 until 1972. The mistrusts that resulted kept individuals from seeking medical care and also turned them away from participating in any kind of clinical trials that might be ongoing at the medical center.
When I think about what happened in the well and how human remains of African Americans were discarded in those limb pits, and then taking it up to what happened in the story about Mr. Tucker and how his heart was taken from him without his family's knowledge in 1968. When you read the book, you really get to see that, wait a minute, Tuskegee's not the only place. Richmond has its own story. For VCU to honestly admit what happened at the well is amazing to me. As slowly Black doctors became certified in Virginia, people knew that MCV was not the place to go. They would much rather be with people that they knew from their community, that they could trust, who understood them and did not look at them as if they were either a charity case or something to experiment on. I think there's a lot more that can be done in the health provider community to continually establish that trust and keep that trust. I think that the Well Project is a real opportunity to bring us together in the Richmond community in a deeper way, because this is an opportunity for us to face facts, face our realities, face the prejudice of the past, and consider how do we work together in the present moment to move forward in the future.
It's not just about hospitals, it's just about healthcare in general. I mean, the mistrust is still there, and some of it is very warranted. There's constant conversation about where to go, who really cares about us. And these are things that weren't just 20th century problems or 19th century problems. They're still 21st century problems. I'm glad to know that the university is is embracing the sharing of the story and then trying to correct this course. And just showing people that you really care about them as human beings and not just cadavers or, or organs in a body, but these are real people who have families, who have lives. It's about owning what we've done in the past, but also owning where we are now and moving forward. So informing people, building relationships, being out in the communities, and then you say something and you do what you say. Then people start to build trust because you keep your word.
In our community, we have a wide array of people from all walks of life who come here for care. Gender, race, ethnicity, different backgrounds and different expectations of the healthcare system. After going through a very deliberate process, we decided the most important thing for all of us was the safety of our patients, our guests, and our team members, and that needed to be primary. So we created STAR Service, which was service, trust, attitude, and respect. Those are the foundational values that we wanted people to emulate in every interaction. People don't care how much you know until they know how much you care. Then they're willing to engage with you. But until that trusting foundation is set, nothing else we do will matter, or it will matter a lot less for their health and their outcomes.
The Civil Rights Act of 1964 would have a major impact on health care, and the reason for that is Title VI, which prohibits discrimination based on race, color, or national origin. And the federal government secured more teeth to enforce that in the next year when they passed Medicare and Medicaid legislation. That funding stream would not be available to institutions that did not desegregate. In that circumstance, MCV took its first very slow steps towards integration of its formerly segregated hospitals. The institution made some changes in August of 1965. They began admitting patients on the basis of medical service needed and not their color. However, the community was slow to lose the association of one particular hospital with one race, so it would take until the opening of Maine Hospital in 1982 and the ambulatory care clinic in 1995 to erase these associations in the community.
Racial bias means life or death for our patients. Our mission is to treat the whole patient, right? Our mission states that we will preserve and restore the health of all people in the Commonwealth through innovation, research, and education. DEI is at the core of all of that. When Mr. Floyd was murdered, a lot of organizations sort of jumped on the bandwagon of creating DEI initiatives. I'm proud to say that here at VCU Health, that work had already started. So by the time I came on board in November of 2020, we already had a 6-point DEI framework. Each of us is unique in our own way, and yet none of us has all the answers. We don't know everything. We also don't know what we don't know. So the one takeaway is, don't stay focused on the mistakes of the past. Instead, use those lessons to inform what you do next. It's important for us to remember who we are and how we show up. The arc of change is slow and it's long. But I think given everything that we've seen over time, we are making progress in the right direction.
Today, Virginia Commonwealth University and VCU Health System are very different than their forebears. And Richmond is a very different city. Rather than reflect the past as it once did, VCU and VCU Health are driving forces in transforming the social, economic, and scientific fabric of Metro Richmond and the Commonwealth. By doing so, we're creating a new and exciting future for the state and our nation. Today, VCU is one of our nation's leading academic medical centers in ethical transplantation, cancer care, trauma and burn treatment, neuroscience, heart disease, stroke, and many other conditions. It is also firmly committed to health equity and access to care for all. We cannot change the past much as we might want to, but we can and we must learn its harsh lessons. Only then will we be ethically equipped to build a future that is much more diverse, equitable, and inclusive than that which preceded it. This is our mission. Your journey starts now.